Ankle injuries. Published by WordPress.com. Ankle fractures, POTS. Epidemiology. One of the most common injuries in orthopedics. Mechanism of injury. Typically caused by indirect trauma, such as twisting or rotational forces. Classification. 1. Donnes-Weber classification. Type A. Fibula fracture below the syndesmosis. A1. Isolated. A2. With medial malleolus fracture. A3. With posteromedial fracture. Type B. Fibula fracture at the level of the syndesmosis. B1. Isolated. B2. With medial lesion, malleolus or ligament. B3. With medial lesion and posterolateral tibia fracture. Type C. Fibula fracture above the syndesmosis. C1. Simple diaphyseal fracture of fibula. C2. Complex diaphyseal fracture of fibula. C3. Proximal fibula fracture. 2. Lodge-Hansen classification. Based on foot position and direction of force. Supination adduction, SAW. Stage 1. Transverse avulsion fracture of fibula or lateral ligament rupture. Stage 2. Vertical fracture of medial malleolus. Supination external rotation, SER. Stage 1. Anterior tibiofibular ligament disruption or avulsion fracture. Stage 2. Spiral fracture of distal fibula. Stage 3. Posterior tibiofibular ligament disruption or posterior malleolus fracture. Stage 4. Medial malleolus fracture or deltoid ligament rupture. Pronation abduction, PA. Stage 1. Medial malleolus fracture or deltoid ligament rupture. Stage 2. Syndesmotic ligament rupture or avulsion fracture. Stage 3. Transverse or short oblique fibula fracture. Pronation external rotation, PER. Stage 1. Medial malleolus fracture or deltoid ligament rupture. Stage 2. Anterior tibiofibular ligament disruption. Stage 3. Short oblique fibula fracture. Stage 4. Posterior tibiofibular ligament rupture or posterior tibial avulsion fracture. Pronation dorsiflexion, PDA. Pilon variant fractures. 3. Fracture variants, eponyms. Maisonneuve fracture. Proximal fibula fracture with syndesmotic disruption. Lefort-Wagstaff fracture. Avulsion fracture of fibular attachment of ATFL. Tillot-Chaput fracture. Avulsion fracture of tibial attachment of ATFL. Volkmann fracture. Avulsion fracture of tibial attachment of PTFL or posterior malleolus. Clinical presentation. Pain, swelling, deformity, and inability to bear weight. Check for syndesmotic instability or vascular injury. Imaging. X-rays, AP, lateral, mortise views, to assess fracture type and displacement. CT for complex fractures or to evaluate articular involvement. Management. Conservative treatment. Indications. Non-displaced Weber type A or B fractures without medial injury. Posterior malleolar fractures involving less than 25% of the articular surface, less than 2 displacement, and syndesmotic stability. Methods. Short leg cast for 8 weeks. Operative treatment. Indications. Displaced fractures, syndesmotic instability, persistent ankle subluxation, articular displacement greater than 2 or greater than 25% of the articular surface involvement. Techniques. 1. Lateral malleolus fractures. ORIF with plate and screws, neutralization or anti-glide. Intramedullary screw or tension band wiring. 2. Medial malleolus fractures. Lag screw fixation, parallel or perpendicular to the fracture line. Tension band wiring or anti-glide plating. 3. Posterior malleolus fractures. Lag screws, posterior to anterior or anterior to posterior. Anti-glide plating. And 4. Syndesmotic injuries. Syndesmotic fixation with screws or suture button devices. Dislocated ankle. Immediate reduction in the emergency room before radiological assessment. Complications. 1. Post-traumatic arthritis. 2. Syndesmotic instability. 3. non-union or malunion. 4. Chronic pain or stiffness. And 5. Vascular injury or talar surface damage.